So Tylenol is considered to be safe in pregnancy. Tylenol or acetaminophen is safe to take in pregnancy. So whenever a patient has any pain, whether it's a headache or muscle ache or any fevers, this is what I recommend giving that the patient takes. Acetaminophen versus NSAID or non-steroidal patients such as ibuprofen or Motrin, those should be avoided in pregnancy, especially in the later trimesters. There are a couple over-the-counter medications that are safe to take in for cold, cough, allergy, nasal sinus relief, and that includes cough drops with or without menthol. If you want to do Mucinex to break up mucus, that's okay. If you want to do Robitussin for cough, that's okay. Loratadine or antihistamines like Claritin are okay to use in pregnancy. The same goes with Benadryl, which is another antihistamine. The most important part is to make sure that the cold remedies do not contain alcohol or pseudoephedrine, which if there's any concerns about whether or not the medication contains it, one is you can approach the pharmacist and make sure that these are okay, or call your healthcare provider to make sure that the medications that you're planning on taking are okay, or just review with them which over-the-counter medications are safe to use. The prenatal vitamins are twofold. So interestingly, what I always tell my patients, especially for those that are seeking a pregnancy, is to start prenatal vitamins before getting pregnant. Prenatal vitamins have folic acid in it, and the folic acid is most helpful at the very beginning of pregnancy. Unfortunately, it's most helpful when most people don't know that they're pregnant, and hence the reason for recommending to start prenatal vitamins before pregnancy is established. So the folic acid is very important at the beginning of pregnancy, and that's to decrease the risk of neural tube defects such as spina bifida. And then the other thing that is very important in the prenatal vitamins is iron supplementation. During pregnancy, we naturally have a decrease in our hemoglobin, which makes us have anemia. This is because of physiologic changes that happen in pregnancy where our blood volume increases, but the number of red blood cells don't increase at the same degree. So there's a dilutional effect. And so we want to make sure that women are taking enough iron supplementation through the multivitamins or prenatal vitamins. If you feel like your diet is rich enough in these nutrients, then taking the multivitamins would be in excess. But because most people's diets are not enough in these nutrients and everything else that is contained within the prenatal vitamins, that's why we recommend prenatal vitamins. If you're taking anything that is in a way redundant or in excess, your body gets rid of it through the urine. So taking a daily prenatal vitamins is helpful in that way to make sure that you have enough of the elements that you need, and anything that is in excess, your body will get rid of. So it's more about the excess of vitamins. So you don't want to take more in addition to the prenatal vitamins. So going through, if you're planning on taking any additional supplements, taking those to your provider and discussing them with them is very important.